So here we just have some standard hydrogen peroxide you can get from the drugstore. Q-tips, you want to let those soak in the hydrogen peroxide for 4 or 5 minutes so they're really pretty soaked. And then this is not too atypical how you might look in the first 24 hours, not to worry too much. But we just begin to apply the hydrogen peroxide to all that kind of dried, scabby blood. And it will always kind of begin to bubble and form that little brown liquid. And doing this for many years, I'd probably say the best thing is just a little patience and persistence. You don't have to get it all on the first Q-tip. Sometimes you can go through 20 Q-tips on the day one cleanup, just getting all that dried stuff to kind of loosen. And notice when you make contact with that dried blood, how it almost immediately starts to form a little fizz and sort of a brownish sort of liquid begins to occur. That's just a normal reaction of the hydrogen peroxide with just human blood as it kind of bubbles it away, softens it, and makes it easier to clean. I'm working for a few minutes here. We didn't want everything on video just for the length, but you can see now things are kind of starting to soften up. It's a little bit of a red color. That should not alarm you. Totally normal after nasal surgery. In almost all patients, you drip for the first 12 hours or so after you leave surgery, but then that body goes into the natural process of just forming little scabs and what have you with platelets. And so that all gets better. So now I kind of have everything almost in kind of a brown to red liquid softness. It's no longer hard. Everything's pretty soft and liquidy. You can kind of see how kind of bubbly that is, but everything's soft. And so to me, that's the conclusion of step 1. And now step 2 becomes dry Q-tips, which act kind of like a dry mop to wick up all that liquid. So these Q-tips now are just dry. There's nothing on them. And they do a great job. See how they just kind of wick up that moisture? And so first step was the Q-tips dipped in hydrogen peroxide. Now we're bringing in dry Q-tips. And just look how they just kind of wick up all that bubbly, soft material that we created with the hydrogen peroxide. And again, just like I said at the beginning, the key here is just persistence and knowing that the entire cleaning process, at least particularly in the initial cleaning, again, it's not uncommon to go through 20 Q-tips. When you initially touch dried blood with a Q-tip, it fizzes for a second, then it stops, and that's when you grab another one. And then the same thing with the dry Q-tips. Once they're not really wicking up, just grab another one and keep working. So now I'm just being a little perfectionist, but I can see how there's still a little dry blood here, so I can go back now and just kind of loosen that stuff. Always be careful on your stitches. You don't need to be too aggressive there in the first cleaning because they're delicate. You don't have to get everything perfect on the first cleaning. Just do the best you can, and what you'll find in the first week following your surgery is that with each cleaning they kind of build on each other, because the last step of cleaning is to apply antibiotic ointment, and the ointment always kind of softens any little bits of dry blood that you couldn't get off in the previous cleaning. So you don't have to always go for the home run on the first cleaning. Just get it really good as much as you're comfortable, and knowing that the third step, the ointment, kind of prepares you for the next cleaning. So again, this is a dry Q-tip now. I'm just wicking up that last round of that kind of brown to red liquid that forms from the hydrogen peroxide. It's near perfect, but we can always make further progress as we clean the nose later today. And so now what I'd like to say is the third and final step. I always say you take a smear of ointment. I describe it as a size of a pea or maybe a kernel of corn. You can kind of see that there. That's about how much you want to use. And then you just go in the nostril as far as the white cotton part of the Q-tip. That's far enough. So get up in there. That corner is always important. Get the corners greasy. And sometimes I'll spin it in my fingers a little bit just to get a nice even coat. And usually it's kind of soothing just to have a little ointment kind of feels soothing, usually to the freshly worked on nose. So I'd use a 3 total. Okay. Three Q-tips, one for the left nostril, one for the right. And the final one, just take a little dab there. You can kind of see that. I call it again the size of a kernel of corn or a pea. And just kind of tap it over those stitches. Don't rub on the stitches too much because the cotton will get stuck in the prickliness of the stitches. And that's it.
Now that you understand how to clean your nose after nasal surgery, I want to go over the common nasal sprays that we recommend in my practice. There always seems to be a lot of confusion for this, and there really shouldn't be. It boils down to some pretty simple principles. We recommend 2 sprays after nasal surgery. One is over-the-counter nasal saline spray. Remember that nasal saline spray has no chemicals in it. Saline is just medical grade, sterile salt water. It's good for flushing out your nose. The other chemical we recommend, the other nasal spray we recommend, is over-the-counter. The drug name is called Afrin. The generic version just says oxymetazoline. And you'll see a lot of different brands of this in the drugstore. So you want the over-the-counter Afrin, it's totally fine to buy the generic, and the over-the-counter nasal saline spray. Now when you leave the surgical facility, you're likely to have a light nosebleed for the first 24 hours. That's where your Afrin is going to come in. Afrin you can use quite liberally in the first day. You can put 2 or 3 sprays of Afrin in each nostril every hour or 2 until your nose really quits bleeding. In Afrin, the chemical, oxymetazoline, helps the blood vessels in your nose constrict, and it helps that drippy nose that's normal after nasal surgery. So use it very liberally for the first 24 hours. Now let's imagine it's the day after surgery. At this point, you want to start to back off on the Afrin and start to switch to the saline nasal spray. Saline, again, has no chemicals in it. It's just there. The saline is only there to flush out your nasal passages. So use lots of saline to flush out the internal nasal passages. You're going to have some old dried blood in there, other kind of yucky stuff inside your nose. Use lots of the nasal saline spray to get all that debris out of your nose. Now let's say that you're in the first week from surgery. Your nose is quite stuffy. Start with 2 or 3 puffs of Afrin. Now you might be only using it 2 to 3 times per day in a 24-hour period. First, decongest with Afrin, wait about 15 minutes, then puff some saline in there. That will start with some decongestion, followed by some washing out of the nasal passages so you can get your normal nasal airflow back.
Remember with the Afrin, it can be addictive.
So you don't want to use it beyond the first week, but you can use it very liberally in the first 24 hours. You can use it on and off about 2 to 3 times a day for the first week, and then you want to back off on it. Because saline spray has no chemicals in it, you can use it as long as you want, but you're probably only going to need it for the first week or 2.